All right, so we are going to go over 5.1 notes, safety concerns in animal nursing. So before we can have a successful examination or even bringing patients in the clinic, we really need to know what safety concerns we have to deal with. You guys are more prepared for this than any other place or any other students because you have been going through school with a pandemic. And so it kind of brings that safety to a forefront. When we start off talking about safety, we're looking at OSHA, so our Occupational Safety and Health Administration. This should look familiar. It should be a review from Unit 2. OSHA does provide those standards for the workplace. So any safety concerns, all of that stuff is OSHA. All right, so you guys should, wherever you work, have a poster that talks about OSHA and OSHA violations and making sure that you are adhering to OSHA standards. So OSHA regulations, big ones that we want to remember, that employees must wash their hands immediately after removing gloves or coming into contact with potential hazards. So even if I have my gloves on, I've got my gloves, they're on, I'm touching all the things, expressing my dog's anal glands, right? So I can still have debris. That debris is on my gloves, even if I take my gloves off properly. So I'm gonna go whoop and whoop. There's a chance, if you guys saw that, I actually touched my gloves, so I contaminated my hands. I need to make sure that I go and I actually wash my hands. So I still need to do that even if I'm wearing gloves. Gloves are not 100% effective, especially if you are not taking them off in the appropriate manner. Next thing, when we're in a clinic, so we're talking specifically OSHA regulations within the veterinary field. The next is human food and drink shall not be kept in or around surfaces or containers that come into contact with blood or potential infectious materials. This means keep your human food and drink away from the animal food and drink. So if you are ever in the animal room and you're going in the fridge, you should not see any human food in it. If you ever do, you need to yell at me, okay? Because that is a giant OSHA violation. So if I'm just like, oh, you know what? I got some munchies really quick. Like, can't I just eat this? But you've got, your animal right next to you that has explosive diarrhea. Not a good idea with your Oreos next to your dog. All right, so that is definitely an OSHA violation. Even your beverages. Because if you have an open beverage, any of the particles that are aerosolized can get into that beverage. And then if you're consuming it, you can potentially put yourself at risk. So no human food or drink in your containers or places where your animals are at or any of your laboratory work. Next, we want to make sure that one of the regulations is that the employers must provide PPE to no cost to an employee. Generally, so this is your gloves, masks. When it's talking about gowns, it's looking at surgical gowns, those things of that nature. Many of you, when you go to a vet clinic, you are allotted generally your employers will give you an allotment towards scrubs. So they may purchase one set of scrubs for you, but you are responsible for purchasing the rest. So that is part of that PPE that would be of no cost to you. But your gloves, your masks, those things are going to be at the clinic for you. Now, this does not mean you get to go and take a handful of gloves and bring them home. It just means when you're at the clinic, you've got them available. So that PPE should be removed prior to leaving work. Ideally, with your scrubs even, have a change of clothes, change before you head home. That way you're not bringing anything into the car with you. And if you do have animals at home, you can minimize the amount of risk that you're putting your animals in by any possible pathogens that can be transmitted. So if you're not wearing an extra pair of clothes or changing before you head out, then make sure as soon as you get home, you put those clothes in the washer if you're able to, or away from any of your animals, and change out of those. So again, you want to minimize risk of transmission. Next is our bins, cans, etc. So garbage cans, yeah, we want to decontaminate those regularly. Also just taking the trash out. So that is your job. That becomes part of your job when you are a vet assistant, even a veterinary technician. So nobody else is going to take the trash out for you. You've got to do it. And then you also want to make sure that those bins, the inside of those containers, are also clean. So sometimes bags fall in to the garbage can, and then when we put stuff in it, we are not paying attention and it gets all over the actual plastic part of the bin. So you do need to make sure that you clean those regularly. All right, now we're going to go into the specific PPE guidelines for tasks. Now remember, our PPE stands for personal protective equipment. So this is what we're looking at when we're doing these tasks. So when we are bathing animals, ideally, you will use gloves. Oftentimes in the veterinary clinic, when you are bathing an animal, you are probably going to be doing a flea treatment, which means you are going to be utilizing some sort of medication or chemical in that bath. So you'd want to protect your hands from that. So you can wear gloves, also splash goggles, similar to regular goggles, but then they may also have that shield on them as well. Sleeves can be used and provided. Think about if you've seen old pictures of printing presses or pharmaceutical people where they've got like the black sleeves just on the arms. That's what we're talking about with that. So if you are bathing an animal, you don't have to worry about getting your arms all wet. Rubber boots are optional. Rubber boots are nice. That way you're not going to slip. You'll also protect your own feet from getting soggy and wet. So that is our PPE for our bathing animals. PPE for dentistry. So think about when you guys go to the dentist, what happens? What are some of the things that they put on you as a patient? And then why, right? Especially, I know I've got glasses, so whenever I go to the dentist's office, I actually take my glasses off because my glasses end up getting dirty, right? Because all that stuff that they're doing in your mouth and your animal's mouth is going to aerosolize, it's going to fly all over the place. So when you're doing a dental and you're performing a task inside of the mouth of the animal, you definitely want to wear your exam gloves because you may have little cuts on your hands that you're not thinking about. Also, it gives you another layer of protection with that animal. And if you do have cuts and things on your hands, you don't want the bacteria from the animal's mouth getting into those things and possibly infecting you. An apron's great, again, to protect your clothing because there is going to be a lot of flailing and flying of liquid and particles. Face shield is great. So you don't necessarily need a giant face shield, but a little face shield is good. If you've got a mask on and glasses, then that also kind of works. So you don't necessarily need a face shield, glasses, and a mask, but that'll work out. So glasses and a face shield or a mask. Your eyeglasses do not count as safety glasses. The lenses are not made of the same quality to protect your eyes if there is some debris that flies off into them. So just keep that in mind. All right, and then we're talking PPE guidelines for x-rays or radiographs. So you can see in that image that lovely man is dressed up. It looks like he's a superhero, not a superhero. I mean, kind of is because he's a vet tech. But he is in lead apron, lead gloves, and a thyroid shield. So you will have lead gloves in your clinic. Whether or not your clinics utilize the lead gloves, that is clinic specific. They should be utilized, though. It is an OSHA standard for you to be using gloves. When you go to your technician courses, that is something that you will need to have when you're utilizing and completing those tasks. Lead apron, you have a thyroid collar, and then glasses, depending on where you're at. So they do have lead glasses if you have a higher extreme of being potentially the scatter radiation. So scatter radiation is definitely something that we're concerned about, which is why we wear the lead. You'll have a light beam, but your radiation will go outside of that beam. Okay, so that is why all of that lead is important, and that lead will protect the beam from going through. So especially depending on the type of machine you're using, we've got this big thing right here. Is actually an old dental radiograph. So the radiation comes out of that little hole. The animal, if it's right here, there's a whole bunch of space though that radiation is going to be able to spread from. So we want to make sure that we are protected when we're in there. You will also find many clinics will have a pedal. So we can push down on the pedal to actually click the button to take our x-rays. Next, we have our anesthetic gas. So believe it or not, your anesthetic gas starts as a liquid. The machine will vaporize that gas or vaporize that liquid into the gas and travel and carry it into your animal. So when you're holding on and caring for that, it is a liquid vial, so you do need to be careful because it's going into a tiny hole. So if you look at our anesthesia machine, so we have, here's the vaporizer, and right in here is where you're going to have to put that liquid. So it's kind of tricky to get into that. So you do need to make sure that you're wearing gloves just in case. And if for some reason that liquid bottle were to fall onto the ground, what is it designed to do? Well, it's designed to knock you out. So you definitely need to make sure that your room is well ventilated and that you inform somebody right away. So gloves, splash goggles, you don't want any of that to come back into your eyes, and a well-ventilated area. Because again, that liquid is designed to induce sleeping, right? So we want to make sure that we are protected. Next is our litter boxes. So PPE, we can see we've got our gloves, our face mask, apron if you want to keep your clothes protected. Definitely good ventilation. If you guys have cats at home, you know how smelly that urine can be along with that fecal matter. So we want to make sure that things are nice and well ventilated. Those, ladies, when you get older and you become pregnant, this is where you can kind of opt out of cleaning a litter box for making sure that you do not get exposed to toxoplasmosis. So with cleaning a litter box, though, there are definitely things that are in that litter. If your animal in the clinic has a potential zoonotic pathogen, you absolutely want to make sure that you are wearing gloves and your face shield or mask at all times. Then we've got our lab samples. So you guys have all, well, when you physically have come in, you've done your fecal flotations. We know that we absolutely can wear our gloves for those things. Now, when we're using or performing what's called a urinalysis, we can also utilize those gloves, and we can utilize splash goggles. So splash goggles, again, are just the plastic goggles that we can cover our eyes with to make sure that we don't get any urine floating into our eyes. And if we're using any chemicals, again, we want to make sure that we're using safety splash goggles, not just your glasses, because you don't want any of those chemicals to eat at your lenses. Some of you may work in clinics that specialize in chemotherapy treatments or offer that. Well, if you think about chemotherapy, is designed to kill cells, right? So we absolutely need to make sure that we are careful when we're utilizing those drugs. So we want to wear 2 layers of gloves. That way we have an extra, again, additional layer. Have an apron to protect our clothing. The sleeves, because if we are in short sleeves, we don't want anything to get on our skin. And we do need a well-ventilated area. So you can see that she's mixing, or that person is mixing the chemotherapy drug underneath a hood. So that hood is going to be ventilated and have a fan to protect any of the fumes will go straight outside into the ventilation system. All right, and then we have our guidelines for kennel work. Those of you that already work in a kennel, you may or may not do this, but I bet you can all tell me if you're working in a kennel with a whole bunch of dogs, it gets very loud, all right? So we want to make sure, if you're not already wearing earplugs, and I'm not talking about your headphones, talking about legit orange. Lots of times they're bright orange. They roll up and you push them in your ears, or you might actually have headphones, or not headphones, but just big earphones, again, not attached to music, but they are protecting your ears from that sound. The dogs and the decibels become so loud that you will cause ear damage. So it may not be something that you get in the 2 days that you start working in a kennel, but 6 months, 2 years down the road, you're going to have long-term ear damage if you are not protecting your ears now. So don't make it seem like, I don't want to wear earplugs. I'm too good for earplugs. You're not too good for earplugs. Wear the earplugs, not your headphones, but actually protect your eardrum. You do not want to have any hearing damage. You also want non-skid shoes, because you are going to be hosing down those kennels or using spray and liquid. So you want to make sure that you are not slipping and falling on that floor. All right, so those are the PPE guidelines. Now we're going to go into handling the actual animals and some of the other machinery and equipment in the clinic. So our safe handling of animals. We definitely want to make sure we review those proper restraint techniques so that way we know what to go back off of, right? So how am I supposed to restrain an animal? That way, if the animal does become fractious or if the animal is a little on edge, I know what I need to do. Before you even handle the animal, make sure you observe it so you can see what is that body posture telling you. How is that animal doing based off of its body posture? We do a lot of that in this room with our animals, especially with the snakes. So we go in there and we look at the snake and we try to see what is its body language doing. Is it coiling into an S? Is it just laying flat? Is it sticking its tongue up to smell? So you want to observe what that animal is doing before you approach. Make sure also with handling animals that have larger eyes and tiny heads, so your Papillons, your pugs, your Shih Tzus and things, and some of your smushed in cat faces, you want to make sure that you're not scruffing or putting too much pressure on the head. You can actually cause the eye to pop out. So you don't want to do that. It would take a good amount of pressure to do that, but wrong place, wrong time. You definitely don't want any animal's eyes popping out while you're handling it. And definitely be aware of those size differences in muzzles. So before we grab muzzles, the one thing I don't have, you want to definitely take a look at the size of its muzzle. What kind are you going to use? If you use a giant muzzle for a tiny dog, it's still going to be able to bite you. If you try to use a tiny muzzle on a large dog, it's not going to work. So definitely be looking at that. And you also, on a brachycephalic dog or a dog with a squished in nose, I want to be very careful if I do choose to muzzle that animal that I'm not restricting its airflow any more than it already is, because those animals do have difficulty breathing. And if I do muzzle, then I'm going to possibly restrict that airflow even more. And then when we're restraining for an exams, we do want to make sure that we're bending at the knees to have that animal on a table if it's a smaller animal. If we can examine the animal on the floor, then we'll do so. Make sure you always have your eyes on that animal. So you never know, even if you're like, oh, that animal's super fine, it's super chill, you don't know what's going to happen. The doctor may do something when you have your back turned, and then the animal may snap just like that. So always have eyes on that animal, never turn your back to it. And definitely keep the animal in a leash or in that carrier. So we want to always maintain control. With cats, sometimes you'll see people put a slip lead on them, just leave the slip lead. I'm not going to try to walk the cat in the clinic, but if for some reason that cat bolted, I would then be able to have access to be able to get that cat out from somewhere it bolted versus having to go and grab a restraint pull, but I could do that as well. And again, you don't know if for some reason that door opens in the exam room, there's another dog, and your dog's not on a leash inside of that room, there might bolt, and then you might have a fight on your hands. So always keep your animals restrained at all times. All right, so here is our equipment. So we have an autoclave, which is that image down to the far left. That is for steam cleaning and sterilization of our instruments. And then we have our centrifuge. So this equipment, it may look old, may look like it's from the 1950s and some sort of sci-fi project, but it is fragile and expensive. You do not want to be the reason that a $3,000 piece of equipment needs to be replaced because you weren't being safe when you were handling it. So definitely ask somebody before you start handling things if you're unsure. And follow instructions for cleaning appropriately. Those instruments are going to need specialized care. So autoclaves we use for steam cleaning. I can't just use any old water in it. I need to make sure I'm using the proper water so I'm not damaging any of the mechanisms inside of those. Some equipment can also be dangerous, right? So we talk about the x-rays and the radiographs. So those machines definitely, if you're in there and you step on the pedal on accident, you take an exposure of yourself, well, you've just collected all this radiation, right, that you didn't need because you weren't being protected and being cautious about it. So autoclaves, again, they use steam, so you don't want to open it too soon. Otherwise, you're going to get a face full of steam and burn yourself. Centrifuges, also, how many of you see the fan, right? You put a fan on, and then you turn the fan off, and the fan's not turning off in time, so you take your hand and you pop it up there, or you take a broom and you go boop, 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 boop to try to slow it down. Cannot tell you how many times people try to use their fingers to slow down an autoclave, or not an autoclave, but the centrifuge. So if I've got my centrifuge over here and I turn it on and it's spinning, 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 and I want it to turn off, well, if I go to put my hand on it, what's going to happen to my hand? My hand is going to get severely burned. And also everything that I just mixed, now I'm rattling it, I'm making it jolt, I'm making it stop in a manner that it is not designed to. So I will then ruin my sample as well. So you not use your fingers or anything else to stop a centrifuge. It will stop on its own free will or its own accord once you turn it off. Be patient. It's okay. All right, and then our x-rays. We did talk about those lead aprons. Make sure you always wear your PPE. Make sure it's on securely, especially depending on your size and the type of equipment or the type of apron. Some of them are Velcro, some of them are ties. Excessive exposure to that radiation can cause cancer, can cause burns, radiation burns. This is why you need to be 18 or over to work in a veterinary facility, because x-rays are your responsibility. So that is that safety concern, because that radiation can cause cancer. You will also have a dosimeter, and it is just a badge that is worn on the outside, and it's going to measure how much radiation you've been exposed to. Every month, the tags are sent in, and then your clinic is given a report of when and how much radiation you've been exposed to. Definitely do not perform x-rays when pregnant because it can affect your fetus. Next thing is our anesthetic machine. So your anesthetic machine is, again, very fragile. Lots of different components to it. There are several things that can go wrong when utilizing them, that once you know how to do it, you'll be fine. With our anesthetic machine, all of them are different. So ours is very kind of bare bones, or looks a little smaller. We have, again, the ventilator right here where the isoflurane, if that's a sedative agent we're going to use, goes in here. We have our oxygen monitor, and the oxygen then flows the anesthetic gas to the patient. This should be filled with a material that will absorb the carbon dioxide, and then we have our actual tube for ventilation, and then you guys have seen the bag often on doctor shows. So all of these things are connected. If I have a loose line in a connection, then my animal's not getting all of the anesthetic gas that it needs, so my animal may wake up. There's also something called a pop-off valve that's in there. This valve is designed to allow the carbon dioxide and the exhalation to actually exhale. If I close this valve, this bag is going to continue to fill, and then the animal's lungs will not be able to decompress, and so you could actually cause some fatal injuries with your animals if you're not paying attention to those things. So I'm not trying to scare you, but definitely you need to make sure that anesthesia machines, that you are very cautious and you learn the ins and outs, and all machines are different, okay? So make sure that you do check for leaks, and that's going to be something that you will learn how to do when you guys go to your technician classes. Definitely always be careful. And if that anesthetic gas, if there are leaks, one, that animal is not getting the gas that it needs to stay asleep for the surgery or the procedure. But then two, again, that gas is designed to put you to sleep. And so you then will get dizzy and you may knock out and fall because you got sleepy. So again, we want to make sure that we're checking that for leaks. And just be aware that animals, absolutely, if something's not done right, you do cause a risk to your animals. All right, then we've got our safe handling of drugs or medications. So when we're filling prescriptions, we have this awesome counting tray, and we have this cool little butter knife. Okay, I'm not using butter on my tray, but I am going to take my pills. I'm going to use this to count them. We want to make sure that we have everything labeled and counted correctly. Always use the tray. You don't know what has been on the table. You also want to make sure that you're not touching the actual medication with your hands, because your hands have oils on them. Who knows? Did you forget to touch whatever it was that you were just working with? Did you forget to wash your hands? And now I'm touching medications. And then that medication, if it's a powder, may break off and may absorb into your skin. If it's an oil, same thing. So you want to always wear gloves, masks, and goggles if you're dealing with those powdery substances. All right, so that is that for our OSHA and safety procedures. So 2 to 3 sentence summaries. There is a lot of good information in these notes. Definitely go back through, rewatch, focus just on that PDF available as well, and sum it up. Make some connections. How are all these things related?